Yeah. So about this talk, what's this one about? I think there are several goals we want to achieve today. So first, this talk will address some of the most common changes a family goes through when a member has cancer. And we'll talk about the changes and the challenges for the family, and how family members can best support cancer patients and each other. We will pay special attention to culturally specific scenarios and coping strategies. And this is a part I particularly want to invite everyone to participate. Before we move on, just think about it. What would be your goals for attending today's talk? As you are thinking about that, we're moving to the next page. Okay. So I already introduced myself. So here's a super fast introduction. Hello, my name is Yun. I'm a licensed marriage and family therapist working at Asian Health and Service Center. You can reach me at this email address. What I didn't put down on the slide is I'm also a family member of a cancer patient. Some of you who went to my previous talk know I like to call them cancer fighters. My own father was a cancer fighter. He was diagnosed with late-stage cancer 3.5 years ago, and he fought for 3.5 years. So I was in China for 3 months being with him in his last days. So I just came back in January. So I'm going to share some of my own experience in my own life, my interaction with my father, and what I have witnessed with my friends and family members who are coping with cancer in this talk with everyone. Thank you, Vivian. We can go on to the next one. So first, I want to emphasize the fact that cancer changes family relationships. So we all know cancer changes family relationships, but how does it change? So here in today's talk, we'd like to go into depth about the changes brought on by cancer. So let's go to the next one. So here's a quote from cancer researchers. They said, cancer is a family experience, and often family members have as many problems coping with it as does the diagnosed patient. I think this slide emphasizes this family, this community nature of cancer and dealing with cancer. So let's move on to the next slide. Here is reflection. I have some questions for you all. So while you are listening to me, I want you to think about yourself, your own experiences, the people you work with, your clients, your community members. Have you noticed any change in family relationships since you or a family member got diagnosed with cancer? And what are the changes you noticed? And how have the changes impacted you? So here, I'm talking to you as if you are either a cancer patient or a family member. But as many of you are helping community members and cancer patients, I hope that we can, using this, we can take the first person perspective. Okay, now we're moving on to the next slide. So there are many changes brought on by cancer. So we're going to go over on the majority of them. And there are pieces that I will not have time and space to cover. And that might be very loud and clear to you, your family, all the people you help with. So that's why at the end of it, I would like to invite you all to think about your own experience and what has addressed, what has not been addressed. So to start with, there are changes in needs, all kinds of needs brought on by cancer. Some of the most obvious changes we can see is physical needs. As cancer patients go through the treatment, and they can experience very obvious physical changes. And they may need to cut down on their work. They may need to do less chores. And they may have side effects such as nausea, such as skin problem, such as other many medical issues that can affect the whole body as a result of the treatment and the cancer. And then we're going to see their increased needs in daily living and in terms of needing help with dressing, showering, walking, and then sometimes at the end, needing help with getting up, getting down, with turning. So those are very practical challenges facing the family. How to help our cancer patients or cancer fighters, I'm going to use them interchangeably in this talk, how to help them to deal with all the physical changes. Together with physical changes come emotional changes. Those emotional changes may not be as obvious, or sometimes we are so busy dealing with all the physical changes, we may not notice the emotional changes, but the emotional changes are as real and as powerful as physical changes. And those emotions need to be accepted and acknowledged. So let's think about it. From the time you or your family member know the diagnosis of cancer, what kind of emotions go through your mind? And then the treatment start. What kind of emotions? Then there's dealing with medical professionals, dealing with insurance companies, worry about the effectiveness of cancer, of treatment, and worry about the future of you and your family, worrying about the children. And then the treatment proceeds. If it's successful, and there are emotions of hope and happiness, but then there's a fear for the future, for the cancer to come back. If it's not successful, then there are other emotions. There are helplessness, sadness, fear. And then there are other also strong emotions I want to emphasize here, which because those are emotions that may not seem as obvious, but as important. One of them is anger. There tend to be strong sense of anger and the resentment at a certain stage of the cancer. Sometimes it could be at the beginning, and anger at why would this happen to me? Or as a family member, what have I done wrong to have this happen to my spouse, my children, my parents? And then their anger that can be directed towards medical professionals. Have they tried their best? Have they treated me differently because I am a different race, ethnicity, and there are other financial and social backgrounds connected to it. And then their anger directed towards other people or other family members or even each other. So those are the feelings that come naturally, but need to be accepted and addressed. Otherwise, they can cause disruption in the family relationship. And guilt is another common sensation here, feelings. Cancer patients themselves can feel guilty for disrupting family dysfunction. Family members can feel guilty for not taking good care of cancer patients. Or as the demands in care increases, the caregivers can get tired, exhausted, resentful, and then they will feel guilty for feeling that way. Not addressing or acknowledging those feelings does no one any good because they are here and they will find a way to come out, whether or not we acknowledge them or not. So it's good that we can be very open and very supportive at the beginning with all the feelings that come up. There's a reason for everything. There's a reason for every emotion. I also want to emphasize the need for love, meaning, and belonging, both for the cancer patient and for family members. We are going through this process together. This is a very stressful process. And then in the middle of it, people may be so busy fighting with the physical symptoms of cancer and forgot that we all need love. We all need to know that we're loved. And we all need to know we contribute to the family. There's a meaning in the life, no matter how sick we are or how badly we're feeling. And then we need to have a sense of belonging. So those are the universal emotions that is important for family members and the cancer patients. And then that will be good to bring to people's attention at the beginning and throughout the entire process. And there are needs in sexual intimacy. This is not an easy topic to talk about. And the patients and the family members may have a hard time bringing it up, but those needs are real too. As helpers, we want to normalize normal human needs and then remind people that if they have needs, they have needs. And also, we know cancer can, or the treatment can impact people's sexual functioning. However, there are ways doctors and counselors can help our patients and family members to find different ways to cope with it. So it's better that we address it than not talking about it and not knowing their ways to improve the situation. So now we can go to the next slide. Then there are changes in roles and responsibilities. The responsibilities, we all know it, their work. As our cancer patients do less and less work, family members may have to pick up the work, or family may face a loss of income. And the same goes for house chores or family duties. And some of the duties that has not been normally talked about is social duties. We as a family have a lot of social obligations, birthday parties to go to, relatives to visit, senior parents to take care of. All those duties can be affected by the diagnosis of cancer and the treatment. Another piece is medical care. Medical care will take on an increasing amount of time and energy for cancer patients and their families. I remember my own father used to say, nowadays I don't do anything else besides going to the hospital and meeting with all kinds of medical professionals. He was frustrated. This is a very real responsibility that family need to pay attention to, because the patients they not only need to seek medical care themselves, they also need family members to support them in the process, to make appointments with doctors, to negotiate treatments, to take them to different appointments, and then to arrange for the last stage of care. And then related to the responsibilities are the changes in roles. When I say changes in roles, I mean sometimes the cancer patients could be the caretaker or the decision maker of the family. And then when that person, that individual has cancer, the individual has to reduce his or her responsibility and sometimes the power that goes with it. And sometimes the decision making is both a blessing and a burden. And it's very hard often for the individuals to let go of that. And as our cancer patients are letting go some of their roles as decision makers, caretakers of family, someone else needs to pick it up. And then this role reversal sometimes can cause challenges, great challenges in the family. I remember when my father was diagnosed, was in the hospital for cancer treatment in China 3.5 years ago. I went back to China, and then I have been gone from China at that time for 21 years, I believe. And I left as a student, so I never worked a single day there. And then suddenly my father asked me to go to talk to the doctors and then to negotiate with the insurance and then the hospital to get him the best care. And then meanwhile, I was thinking, gosh, I didn't know what to do. I didn't know the society. I didn't know how things work. And then meanwhile, my father, who has been the one that been telling me what to do and has been, laying in the hospital by relying on me to do it. So this is an example of role reversal. And there were a lot of emotions going with it. And then there are a lot of stress. But that experience helped me to help a friend. So recently, when I was in China helping my father, my college roommate was having a very hard time with her own father who had serious illness. Her father had been healthy and independent, even if he was in his 70s. And suddenly he was diagnosed with very severe illness, not cancer, but very similar in terms of the disruption in his functioning. And then suddenly he changed. My friend said, my father, my loving father, changed overnight. This is suddenly my father became very demanding. He asked me to go, to talk to the doctors to get him all kinds of treatments when, I don't know what to say and I'm not used to do that. And my father called me or texted me multiple times a day, telling me every little thing that's bothering him. He said, that's not my father. I don't know what to do. And then she was having a very hard time with it. So I think one of it fundamentally is there's a role reversal here. The father was no longer feeling confident or strong enough to take care of himself. He wants his child and then the daughter who was closest to him to take on the duty, but they didn't talk about this. So the daughter was suddenly thrown into this role of a caretaker and a decision maker, and then she wasn't prepared. But after processing this together, and then she was able to see, yes, this is what her father needs from her at this time. And then she's taking on this role of caretaker and decision maker. Meanwhile, there's constant negotiation in this, right? So we're going to talk a little bit more about children having a role reversal when a parent has cancer, and then the negotiation process. So later in the slides. So for now, we're going to move on to the next one. There are other significant changes. I listed them, but I don't have time to talk about all of them in details. So for example, their self-image, how the patient sees him or herself. So think about my friend's father who was in his 70s, was strong, independent, was loved by everybody. So the first time he was in the hospital, he was the favorite of all the doctors because he was funny, he was knowledgeable, he was wise. And the second time he went back in, he was so weak that people no longer want to spend time with him. And his image of himself changed. And we all know our self-image can be profoundly impacted by how we're treated by others in our surroundings. So self-image change is something that we need to pay attention to. Along with self-image, there were relationship patterns. There are people who might be close to us and then become distant, when we're diagnosed with cancer, or become distant with the family. Sometimes because people don't know how to talk about death or cancer, or sometimes for other reasons. And then there are people who previously was not very close to us, can rise up to this occasion and become extremely supportive. So we do build new relationships. I remember when I was in China 3.5 years ago, taking care of my father, being totally lost in a system that I didn't know. I really did not know how to negotiate and navigate. And I ran into my high school roommate who didn't talk to me. We didn't talk to each other for almost 20 years. And then we got reconnected. And then she was saying, oh my goodness, you need help. And I'm the only child, so really have no one to talk to. And she has turned from a little sister when we were in high school to a big sister to me. So she talked to me through all the procedures and all the process, and she held my hand. So this is good and bad changes in relational patterns that comes with cancer. Marital status. Marriage experience extreme challenges during the cancer treatment. And it's not unheard of for people to get divorced or for marriage to have more conflicts than they used to have. Children's behavior. We're going to talk more about that. Children are affected by cancer, no matter how hard we try to protect them. And then they will have some natural behavioral responses. Daily routine. I think this is something I don't need to specify. I think a lot of people's lives are changed for good with a cancer treatment. We pay attention to what we eat, what we do, how much activities we can carry on. And then future plans. This is something that's not often talked about, but it's important. When a cancer is diagnosed in the family, a lot of dreams, hopes have to be changed and revisited. The dream of retiring together, of traveling together, of visiting relatives in a different country together, of saving for children together, of taking care of grandchildren together. All those things have to be revisited. And there will be a lot of emotions, disappointment, sadness in this. Social networks. Cancer limits how much time and energy and money we have to do things, all things. And then sometimes it limits the social contacts we have. And the social networks can suffer as a result when people don't have that kind of time and energy or money to go out with existing friends. But new friends can be built, can be developed. So those are some of the major challenges that come with cancer. So my question to you all is, as you are listening to me, think about what are some of the unique changes to you, your family, all the families in your community or in your culture. So we're going to move on to our next slide. So here's a reflection. I want us to take a deep breath and have a quick scan inside. What I mean by quick scan is, after taking a deep breath, quickly reflect on your body, your mind, your emotions, and then see what kind of thoughts, emotions, and bodily sensations are you experiencing right now. So what we have been talking about can be triggering depending on our experiences. Sometimes the sensations, the responses come out as bodily sensations. We could feel pain, right? We could feel nausea. We could feel tense. We could feel shortness of breath. And if at any time, if you feel like what we're talking about is too much, too triggering for now, it's okay to take a break from this and come back to it. If you feel that you're also okay, then I will encourage you to pay attention to your thoughts and feelings and your body's sensations to see what messages you are receiving. I love to talk more about this, maybe at the end of it. So now let's come down to the next slide. Now we're talking about something good. After talking about all the changes, we're talking about benefits of positive family relationships. So thank you, Vivian. We can move on to the next slide. First off, let's talk about benefits of positive relationships. What are the positive relationship benefits? There has been plenty of research on this. They make us live longer. We have fewer health problems. We have better mental health, and we're happier. So social connections give us pleasure, but they also influence our long-term health in every way, every bit as powerful as adequate sleep, good diet, and not smoking, to name a few. Dozens of studies have shown that people who have social support with family, friends, and community are happier and living longer and having fewer health problems. Meanwhile, there are also studies showing that people who don't have positive relationships suffer in their relationship, in their health, in their mental health, in their mood, and in their mortality. So there was a study that looked at over 300,000 people and then found out a lack of strong relationship can increase the risk of premature death for all causes by 50%. So this is an effect as big as smoking 15 cigarettes a day. So as increasing research have shown us the importance of positive relationship, let's go down to the next slide to look at the benefits of positive family relationship. Why do we emphasize family here? Because family relationships play a central role in all our lives, and also because for a lot of our cancer patients, fighters, or their families, family relationships are even more important, as the cancer and treatment could be limiting some of the social network and the connection they have. Sometimes family is all people have, and all we have to carry us through difficult times. So I was looking for relationship between positive family relationship and cancer survival rate, and I did find a study. There is a 2009 study by researchers from Indiana University, and they look at marital status and the cancer survival rate. So they look at almost 3.8 million people, Americans with cancer. And then they found out the cancer patients who are married have way better survival rate than people who are not married or divorced. And most significantly, the group that has the worst survival rate or the patients that have to undergo separation or divorce while they're diagnosed with cancer. So now we'll come down to the next slide. So what are some of the benefits, the specific benefits of positive family relationship? So I'm listing all this. Those are just reminders for us to think about what we have noticed, what we have experienced, how we will be carrying the conversation with our community members or people we help. Physical benefits. My own father lived, I believe, but I know because doctors have been telling us that he only had a few months to live 3.5 years ago. And those are doctors who are experts in the field. And then he fought and he enjoyed his life and the relationship in the 3.5 years that he was able to have after the diagnosis. So with personal experience, I can testify the importance of positive family relationship on his physical health. A lot has to do with stress. When we experience positive family relationship that protect against the stress, and we know stress affects our heart, our immune system, our skin, our insulin intake, so many areas in our lives. And then there are benefits of positive family relationship on our emotional experiences. I think this is pretty obvious for all of us to see. One thing I want to point it out is even with positive family relationship, we're going to experience emotional up and downs. There's going to be hopelessness, anger, depression, helplessness, frustration, impatience, so on and so forth. There's going to be those emotions at certain stage of the cancer treatment. And that's okay. A positive family relationship lends support and strength to each other and help people to go through difficult times. And then there are behavioral consequences. And we also know that when we're feeling all those negative emotions, our behaviors change, whether or not we want it. We can become very impatient. We snap at people. We bang on the doors. We didn't want to listen. We yell, we shout. And then we turn to other things to help with emotional control. We go to alcohol, we go to drugs, we go to gambling, we go to other kind of addictive behaviors to get us out of the current pain. So those are all behaviors that can be affected by stress that brought on by cancer. And a positive family relationship, open communication, ongoing support and love will help us to will help us not only to reduce the emotional stress, to release our behavioral burden, but also to help as reminders for each other. You know, if one of us were having certain behavior issues that are pushing each other away. And then self-worth and self-esteem. I think I touched base on this already. So much of what we feel about ourselves depends on the feedback we have from the environment. You know, if the environment is loving, supportive, and everyone was saying you are great, you do feel great. If the environment is very invalidating, and for example, for a caregiver, no matter how hard you try, all you got was negative feedback. The cancer fighters you care for was complaining all the time, was complaining that you didn't do all you could to help them, was complaining about life. So that does not make you feel really good. Or if you are not getting enough support from the community, and to know that other people going through similar things with you as you are, and you will feel alone. You will feel like you are stuck in this endless fight alone. And then you and only you are doing such a poor job. So positive family relationship definitely affect people's self-worth and self-esteem. And think about the cancer fighters and patients. They are suffering physically, emotionally. They lost a lot of functions. They lost a lot of say in their own life. They lost a lot of pride. And if they don't get support and validation and love from their family members, how are they holding up their self-worth and self-esteem? And then, you know, needless to say, and there's hope. Sometimes hope is all we have to carry us through. And we all can imagine the impact of family relationship on the sense of hope and optimism and overall well-being. So we're going to move on to the next slide. Here is a reflection. So I want to invite you to think about a past experience of positive family relationship. It doesn't have to do with cancer or illness. So I just want you to imagine a past experience in which the family supported each other. And I want you to think about how has the family support helped you through difficult times? And which part of the relationship that struck you most? So I do want to give us just 1 or 2 minutes to think about this. And also to have a reflection on yourself, your body and your mind. How are you feeling right now? What are some of the things that pop up in your mind? Do you have any questions? Specific feelings? What struck you? So Vivian, we can move on to the next slide. So the next one is about working towards positive family relationships. What are some of the things we can do to cope with stress and to work towards a positive relationship in the family? So we're moving on. The first piece, in my opinion, is knowledge and acceptance. Sometimes they seem So as if, it's so shallow, we take it for granted. But in my opinion and in my practice and experience, to really know what's going on with us, what's going on with the family members we care for, or the people who we are assisting with, to really know that and to really acknowledge it in our own heart, this is happening, can means we're 50% done with success. Often it's very challenging for us to really know all the needs we have and the limits we have. When I talk about limits, I want to emphasize it because none of us is superhuman. No matter how much we want to help, there are limits in terms of how much we can help. For cancer fighters, there's limits in how much work they can do, how much house chores they can carry, how much contribution they can do during treatment. And sometimes people feel so guilty about that and then try to do more. And sometimes people try to go back to work before they're fully healed and therefore cause longer consequences in health and the emotional needs. For caretakers too, caretakers have their own limits. We all know caretaking is a full-time job and it's harder than most full-time jobs, I think. There's physical, emotional drain on caretakers. And a lot of caretakers feel guilty about feeling the different emotions they feel. There could be resentment, there could be tiredness, there could be a whole range of other feelings. And we sometimes want to brush that away because we want to be there for our loved ones. We don't want to acknowledge that we can only do that much as we can as a human in the specific moment in our lives. So knowing our needs and our limits and acknowledge that is very important. After that is acceptance. Acceptance means we accept the ones that we have no control over and we're okay with it. We'll find ways to deal with it, but we're not going to beat ourselves up. And then compassion has been such a hot topic in the mental health field because people have been realizing more and more the healing power of compassion, especially self-compassion. Some of you may have saw the video that I shared with you in the previous talk about self-compassion. And then, so those are done by researchers who are doing scientific studies on the power of compassion and self-compassion. There's another piece I want to suggest here is open communication. And this, I want to check in with us about our cultural specific scenarios. So here, the mainstream suggests that, we talk openly about our needs, our limitations, and our possible solutions. And those are good suggestions in general. But sometimes in our cultures, it's difficult to talk openly about certain things. And then what do we do about it? I remember my own father, who is a very open person. He is an engineer by training and he's a physicist by education. So he had been looking at things very matter-of-factly all his life. And me as his child, knowing him, thinking that we can talk about everything in his cancer and treatment, until I realized there are some things he's just not ready to hear. And in our general culture, and there are also some cultural practices, there are people advising us not to disclose even the diagnosis with the cancer patient, and thinking that the diagnosis alone will scare people into death or worse health or worse prognosis. And those, I don't have clear answer for that because this vary by individuals and by families. and also vary by the cultural practices that you believe in. I think a few years back, there was a movie called Farewell. It's about a Chinese family, a Chinese American family going back to visit her grandma, and then her parents' mom in China. And then there was a cultural practice that you cannot tell the grandma that she's diagnosed with cancer. So the family, the children all came back from all over, from different parts of the world, but meanwhile they have to find the excuse for that, So they pretend there was a wedding. So here, here on one hand, the children are mourning the upcoming death of their own mother. On the other hand, they have to put on this happy face to throw a wedding which is fake. So it's a dark comedy. I think that really addresses some of the cultural practices we have. So this is a piece I want to talk a little bit more in depth with us during a discussion. So after this slides, when we're going to our question and answer and discussion session, I hope that we have a chance to talk more about that. So now we're going to move on to the next one. Reset your goals. What do we do? So we accepted what has been here, always in front of our eyes. And what do we do about it? We recognize cancer brings changes, and the changes require re-evaluation of life goals and steps. And what kind of goals and steps are more appropriate now? So people can still make long-term goals. Also, it's very helpful to start looking at smaller, achievable goals. The small goal can be finish this round of chemotherapy, can be let's get this treatment, let's get that doctor who's an expert in cancer treatment, and then could be let's take care of tonight the side effects from this round of chemo, and let's take care of the nausea, the mouth pain, the everything tonight, and then tomorrow when we see the light, we celebrate. So I think it's so important at the time of constant challenge to remember to celebrate and to remember to aim small and to set really realistic goals. So now we're going to the next slide. Enjoy life and each other. It may sound counterintuitive. We are suffering, and then we're facing possible death. How are we going to enjoy life and each other at this time? I am very grateful for Gemma. So before I left for China to take care of my father who was dying, I needed support myself. So I reached out to Gemma, and Gemma and I had a very good talk, which really profoundly changed how I see things. And one of the consequences of our talk is I'm determined to have a good time with my father in his last days. I don't want our memory to be all about visiting doctors, going desperately from hospital to hospital, and crying and sadness. I want us to remember the love that we have for each other, to have a good memory. So when I was there, when my father's situation allowed, we did things he wanted to do. We fulfilled some of his last wishes, which could be small, including he want to go out to see fall leaves that turned color. So we did that. We went out in pouring rain on the last day of the really beautiful fall leaves to see them. And then we pushed the wheelchair through the rain so my father can see them. And when we thought back later, when he was in hospital bed, we just felt like, okay, that was such a beautiful memory. I will always remember that. I think my father also appreciated that. So once again, it is not the quantity, but the quality that counts in relationship. When we think about it, how many times have we spent time together with family members under the same roof, but not talking? We're doing our own chores, looking at our own phones. We're not talking to each other. Or when we talk about everyday stuff, what we need to do, chores we need to do, things that troubled us. We don't really talk about things that bring us joy, make us feel connected, or make us feel loved. And the cancer actually can be a wake-up moment for us. A moment that showed us there is important things, as important as all the practical concerns in this relationship. That matters. And we need to take care of it now. We need to pay attention to it now before it's too late. So self-care is a big part of it. So we cannot take care of each other or our cancer patient members without taking care of ourselves first. It sounds selfish, but really it's true. If we are tired, stressed, cranky, impatient, how are we going to be our best for our family members? Sometimes we need some time alone for ourselves. We need to go somewhere, do something we enjoy with our own circle of friends. And with that, it's like we're adding gasoline to the car so we can run again. We can come back and be present again. So I want to emphasize that. I want you all to give whoever you work with the permission to take care of themselves so they can be better caretakers. And then the last one really is a question. There was a popular psychological exercise and for people to identify important things in their life, which is imagine you are going into a building. And then in that building, there are all those people that matter to you most, your family members, your children, your friends. And then they're all there for you to remember your life, to give speeches about you. And that's your funeral, your own funeral. What do you want them to talk about you? How do you want them to remember you? And then that can help us to decide what's important in life. So at this point, my father's not with me. Do I remember him by how many credentials he accumulated in life? How much he's paid when he was working? Or what kind of job he does? No, I don't remember that. I don't, actively remember that. What I remember is how much he loved me and how much I loved him. Yeah. So we can move on. I think we're coming to the end of my talk. The last piece, but super important, cliche, but I want to remind us over and over again, remember to get help. Sometimes when we're in the middle of busyness, craziness, we forgot there are help out there and we cannot do it alone. Physically, practically, sometimes if it's too physically challenging to care for the cancer patient or cancer fighter yourself, it's time to ask for some help, to get some help, either paid help or reach out to other families or friends and say, can you come here and give me a break or bring some food here so we don't have to cook? And I think a lot of us have been doing that to family members and community members. But we need to remember that we can ask for it too when we are in the middle of it. Emotional help, informational help, those can mean a lot. Coming to talks like that, coming to support groups to share our experiences and knowing that we're not fighting alone. And then knowing there are a lot of things we can do to help us to feel stronger, to feel more connected. There is also another study, I just quickly mentioned it, looking at parents whose children have cancer, young children. And then found out the majority of them have PTSD, post-traumatic stress disorder. Those are the disorders that were developed by people who are in a near-death or death situation, like soldiers on the battleground, like if we got into a car crash. But majority of the parents whose young children have cancer have PTSD. That just tells you how much cancer impacts us. And when we have PTSD, we need treatment. We cannot just shoulder it on and deal with it alone. So where can we go for help? There's so many places, and I'm just throwing something as a starter, right? Family, friends, community, church. Don't forget the professionals, doctors, counselors, social workers, social agencies, or places like here, or support groups that you can find in the community. So this is just a beginning of the list. So now, Vivian, let's go on to the next one. So the next one's children. We already touched a little bit on children, but I want to say a little bit more. So here for children, I was mostly thinking about young children. Sometimes we want to protect the children. We want to not tell them what's going on because we don't know how they handle it. We think, oh, children wouldn't know, or they act like they don't know. But decades of research and practice in family counseling tells us children know. Children are so intuitive. They may not know exactly what happened, who got what disease, what illness, but they know something's not right. And if we don't talk to them, they think that may be their fault or something there's beyond their control is happening to their family. It's a vague scariness that's hanging like a cloud that doesn't go away. So talk to children about what's going on is important, but we need to talk to them in ways they can understand and can deal with. So we talk to them depends on their developmental stage and how old they were. It can be so general as, grandpa is sick, grandpa has cancer, grandpa is weak, grandpa want to see you because grandpa wants to spend more time with you. But when you see grandpa, he might be lying down because he doesn't have much energy. To talking to older children with more specific details. And also we want to pay attention to the behaviors children will show us. When they are showing us through their behaviors what they cannot tell us in words, when they're scared, stressed, young children tend to get more anxious and clingy. Teenagers tend to get more angry and withdraw and distancing from everything and the family. And those are all okay. Those are normal behaviors. Those are cues for us to notice something is going on and we need to sit down with our children and talk about it. And I mentioned role reversals, children as caretakers. I think that needs a lot of negotiation and discussion in the family to make sure the children are taking on what they can shoulder. Depends on their developmental stage. To know that they have enough support from the parents and appreciation from the parents for it. So all in all is we need to balance our needs with children's needs. The needs on our end, on children's ends, are all valid. Self-care and compassion, along with care and compassion for our family members. I think that's the end of my presentation.